And as long as you continue to have pockets of unvaccinated people, if you don't have what we call adequate herd immunity, it's inevitable that we're going to have this happen again.
That's what Clark County's public health officer says it keeps him up at night. Dr. Alan Melnick says low vaccination rates and the spread of misinformation about measles could lead to another outbreak.
Regardless of what's happening in the world, this could have been completely preventable in Clark County if we had higher vaccination rates here.
71 cases were confirmed in Clark County since the wave of the virus started spreading in early January. There were 73 in the count, but 2 people moved out of state. 93% of cases were in kids 1 to 18 years old, and 61 cases were in people not immunized. One person was hospitalized.
Measles is a serious illness. It's not a benign illness. And we're fortunate that we didn't have more cases, because if we had, we would have seen more complications.
It started January 3rd when lab testing confirmed a child who came to Clark County from Ukraine was infected with measles. But public health can't determine whether that was the source. For about 2 months, more than 230 people from multiple agencies worked on ending this outbreak.
When we're doing this outbreak investigation, we're working around the clock.
In total, Melnick says it cost the county nearly $865,000, with staff costs taking up the largest chunk.
So many of them would be working overtime, but a lot of them were pulled from their regular jobs where they would have been doing jobs that were either grant supported or fee supported in some way.
Plus transportation, supplies, a phone bank contract, and lodging for out-of-town help.
This is something that was completely and utterly and 100% preventable, and that was $865,000 that went to that when it can been going to a lot of other public health needs.
Clark County Public Health pinned down 53 public places where people with measles may have exposed others, including healthcare facilities, schools and daycare centers, and other public spots.